Welcome to the Counselor's Soapbox video series. This is part 6 in the drug education series using the DSM-V to diagnose substance use disorders. For something to be diagnosable for mental health purposes, it has to be causing the person problems. There are 4 basic ways in which those problems can be identified. When something interferes with social functioning, that is, when it interferes with relationships with family and friends, if the activity or behavior interferes with occupational functioning, the ability to have a job and keep a job, or for those who are in school, job is considered their occupation. Also, if the problem causes the person subjective distress, if they say this is a problem which is making them miserable. Lastly, a new criteria which was introduced in the DSM-V, does this problem interfere with an important area of functioning? That is, was there an activity, a hobby that the person used to enjoy in which they no longer engage because of the particular problem? In that case, it should be diagnosed. There are a number of factors which must be taken into consideration in creating a full mental health diagnosis. First are the numbers which are used for classifying, recording, and billing. The numbers come from the ICD, International Classification of Diseases, and this system is constantly being updated and amplified. For our purposes, discussing diagnosing drug use, first we have to pick the drug, and drugs, as we will see in a moment, are categorized into a handful of major categories rather than each and every drug the person could be having a problem with being listed separately. Once we're certain that they're having a drug use disorder and we've classified it by the particular drug, we also need to know how severe is this problem. Drug use disorders are classified as either mild, moderate, and severe, and there are different criteria for each of these. Besides having a use disorder, someone may be currently under the influence, which we call intoxication, or they may be detoxifying, the drug being removed from their system, which would be called withdrawal. Using a lot of drugs over a long period of time, or even a large amount of drugs for a short period of time, can alter the brain and the functioning of the person. That may create a drug-induced disorder. And lastly, there are some miscellaneous drug problems which are hard to classify, and for that there are terms called unspecified or other specified drug-related disorders which the professional can use. Here's a list of the DSM-V drug categories listed alphabetically. You'll notice that all of the numbers begin with F. Mental health professionals should only diagnose disorders beginning with F's or Z's. Those are the disorders within their scope of practice. Other medical specialties have codes which begin with other alphabetical indications. Alcohol is F10, then there's a dot, and 2 digits after that, which can be used for various specifiers. Caffeine is F15, again with potential specifiers. The current time is pretty well limited to caffeine intoxication, an overdose situation. Cannabis, primarily marijuana, but could also include hashish or hash oils and various other compounds, is an F12 diagnosis. Hallucinogens are placed under F16. This can include a wide variety of only barely related compounds. Also, there are some newer synthetic compounds which becomes very hard to find a place to classify them. F18 is the inhalants. Again, the main characteristic of inhalants is the way in which people take them into their body, and this can include a wide variety of chemicals. Opiates, or opioids, are diagnosed as an F11, and it doesn't matter whether it's a prescription drug obtained from a doctor or a prescription grade drug obtained illegally, the categories would be the same. Similar drugs, sedatives, hypnotics, and anxiolytics or pain medication are diagnosed as F13, again with specifiers. Stimulants are a big enough category that they are subdivided. F14 is cocaine, and amphetamines are placed into F15. For mental health and medical purposes, there's a single category, amphetamines. Notice that people who work in substance abuse often have a longer and different list of chemicals that they are diagnosing. So in drug treatment, there would be a separate category for amphetamines, which are largely prescription medication, pills, and methamphetamine, an illegal street drug, which is also a type of amphetamine, but which is typically used illegally. But in medical settings, if it's an amphetamine type drug, it's given an F15 and number plus some specifiers. Lastly, tobacco is listed under F17. Thanks for watching this episode of Counselor's Soapbox videos. Drug Education, Part 7, How Drugs Affect the Brain and the Nervous System, is up next. This is a somewhat longer presentation, as drugs have a lot of unique ways in which they affect the brain and the nervous system. If you've liked this post, please click the like button, which you'll find directly below the video. Also, consider subscribing to the Counselor Soapbox video channel so that you receive these videos as they're released. Comments are always appreciated, and I have promised to try to answer as many of those comments as possible as quickly as possible. For more information, please visit the Counselorssoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.